Hi everybody out there, this is Dr. Palmer broadcasting from Pure Joy Pediatrics, and this is Pure Joy Parenting Tips. And try to bring you tips that will be helpful with your job, your very busy job as parents out there, every Thursday at 12:30. I'm running a little late today. Hi there. I'm running a little late today because I actually was seeing a patient with a rash. And I always like to talk about, hi everybody. Hi Dr. Funke. Hi Dr. Quirk. I always like to talk about things I've seen in the office, and so today I figured we'd talk about rashes because I've seen quite a few of those in the last couple days, and I absolutely love, hi Rajmi, I absolutely love skin. Talking to parents about skin on their newborns, skin on their children and adolescents. And I love looking at rashes. I think probably in another life, maybe I would have been a budding dermatologist. But today I saw a very interesting rash. This was a kiddo that had, she had a cold, so runny nose and cough. And then a couple days into it, hi Mercy, a couple days into it, she developed these very large, raised, white hives. Hives are very characteristic. The skin is always raised. They're kind of bumpy around the edges, and there's usually like redness around the base of the hive. And you know, she's a kiddo that has a lot of she has sensitive skin, and so sometimes gets hives. But where we started to get a little bit more concerned was now hives are very dynamic. Sometimes they usually will go away and come back, and they'll come back in different places. But hives can also be just the first of a symptom of a rash that is going to evolve. It's going to change over time. And that's kind of what happened with her. So she started out with hives, and then got her eyelids became swollen, her earlobes became swollen, the skin around her joints became swollen, and that is not super typical of hives. And in fact, the hives changed into a different kind of rash that was kind of red and raised and no longer looked like hives. The reason why I wanted to bring this up is just to kind of point out that any rash that you see can change over time. And as a pediatrician, I'm very interested in looking at rashes that change over time. This one in particular became a little bit more worrisome because the hives had turned into something red, and they may actually progress into something that looks a little bit more purplish, which again is not typical of hives. And this could actually be a little bit more characteristic of something called vasculitis, which is inflammation of small blood vessels in different parts of the body, including the skin. And so this kind of rash is a little bit more worrisome than other rashes that I see. I usually will tell parents if a rash looks like it's progressing and it's getting worse, especially if you're having other symptoms like joint swelling, that's kind of a big red flag, or fever. It could be that the rash is now actually an infection itself, or is a reflection that you are fighting some other infection on top of having the hives. And so those would be reasons actually to come in and see a pediatrician. As I said, I love looking at rashes because it's really like pattern recognition. I sort of think of it like if you go out to the seashore and you're picking up shells and you recognize different shells. It's kind of that dynamic for me too. I look at different rashes and I recognize that rash right away. Other rashes that I've seen this week, I've seen a lot of eczema. And I'll tell parents, look, if your child does have eczema and they have an eczema patch that just doesn't seem to be getting better, then there's a good chance that eczema patch now is co-infected with some other microbe. Could be fungal, could be viral, could be bacterial. And these are things too, to come in and actually have your child be seen for an eczema patch that just doesn't seem to be getting any better. And sometimes they actually get worse. Children with eczema are much more at risk for bacterial, viral, and fungal skin infections on top of having the eczema. Because remember, having eczema is kind of like having a chink in your armor. If you think of like the skin is kind of like chain mail that they used to use in the days of, warring nights, where they would put on this basically little links of metal together, and they would make actual like headdresses and chest pieces and even pants for the knights to wear, so that if they were in a sword fight or a jousting fight, that the sharp tip of the sword or joust would not pierce through the male and maybe protect their bodies from harm. Our skin is like that too. It's like chainmail. And it protects our bodies from harm. But if your skin is open, like you have a cut or you have eczema, then there's a chink in your chainmail or there's a chink in your armor, and microbes are much more apt to climb in and cause infections. So rashes can be caused by all sorts of things. Like I mentioned, viruses can trigger hives. Sometimes things you've eaten can trigger hives. Eczema is a chronic skin condition that we end up kind of battling with for sometimes even years. But I love looking at rashes. I love talking to parents about eczema, how to take care of it, how to recognize when things are getting worse. And so if you are in the Portland area looking for a general pediatrician, I am open to new patients. We're out here in the Tigard, King City, Progress Ridge area, Pure Joy Pediatrics. I'm Dr. Palmer. I would love to talk to you about your children's skin and rashes and any other thing affecting your kids. Our number is 503-420-8667. Give us a call for an appointment. Take care.